The broadcast is now starting. All attendees are in listen-only mode.
Welcome to the webinar, everybody. My name is Jessica Burke, and I'm along here with Andy Capehart, and we're with the Adult Protective Services Technical Assistance Resource Center, APS TARC. Welcome to our event, Adult Maltreatment Report 2022, What We Know and What We Don't, with our presenters, who I will introduce here in a bit. Next slide, please. Just a quick disclaimer, this webinar is being hosted by the APS TARC, which is a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and is administered by the WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the federal government. Next slide, please. Now on to some housekeeping. In the handout section of your webinar control panel, you will find today's slides. You may download these at any time. Please use your computer speakers to access audio for this webinar. Please make sure the speaker volume is adjusted to your desired volume. If you're experiencing audio problems during the presentation, we recommend that you sign out of the webinar and re-enter and log back in. Next slide, please. Enters at any time by typing them in the questions box. We'll relay as many as we can to the speakers when we pause for questions. This webinar is being recorded, and all registrants will receive an email with the recording when the recording is made available on the APS TARC website. Also, will receive an automatically generated email approximately 24 hours after the webinar ends with a link to certificate of attendance. We're so sorry, but CUs are not offered for this webinar. Also, to hear your feedback. You will be prompted for a brief survey, and we encourage you to take that. Next slide, please. Now I'd like to launch a quick attendee poll so we can get a sense of who's in our audience today. I'll launch that poll now. Our question is, what profession do you identify most with? Single choice answer: adult protective services, medical, legal, academic, or other social services. So we'll leave that up here for a few seconds for you to vote. Choice answer: what profession do you identify most closely? Adult protective services, medical, legal, research or academic, or other social services. And close that poll. Right. We have a lot of representation from adult protective services at 67%. Next, we have other social services at 22%, and a handful in research, academic, legal, and medical. Well, thank you all for being here and investing in your professional development. Next slide, please. It is my pleasure to introduce our speakers today. We have Senior Research Manager with the APS TARC, Carl Urban, and we also have our Senior Research Associate Subject Matter Expert with APS TARC, Leslie McGee. I'm going to hand it over to you all. Thank you.
Next slide, please. I'm sorry. Good afternoon, everyone, and thank you for your interest and attendance today. As Jessica said, I am Leslie McGee, and I work with the APS TARC, where I work with Carl and other members of the TARC team, assisting APS programs with their annual NAMRS submissions. We've prepared today's presentation with the intent to accomplish the objectives listed on the screen. There has been a lot of activity around NAMRS this past year, including plans for expanding how the data is used, as well as some changes to the components themselves, and we will cover those today. Next slide, please. Sorry. The mission of the APS TARC is to enhance the effectiveness of APS programs. We do this through these three work streams that focus on supporting federal, state, and local partners' use of data and analytics, applying research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing APS programs with individualized technical assistance. Next slide, please. The data we obtain through NAMRS is essential to the APS TARC's success in fulfilling our mission. It is the foundational information we use for our efforts to enhance the effectiveness of programs. The data feedback loop helps inform what we need to do, why we need to do it, and tells us whether what we are doing is having an impact. Next slide, please. So let's talk a little bit about NAMRS. Next slide, please. The goal of NAMRS is to collect consistent, accurate, national level data on the maltreatment of older adults and adults with disabilities. The information is submitted to NAMRS by state APS programs. Next slide. NAMRS is used to support ACL's efforts in better understanding adult maltreatment in order to provide better responses to it, address service needs of those impacted by it, and prevent maltreatment before it occurs or from occurring repeatedly. Next slide, please. There are multiple entities involved in operationalizing NAMRS. WRMA Incorporated designed, developed, and implemented NAMRS, and currently provides the ongoing technical assistance through the APS TARC. ACL authorizes, funds, and oversees everything that happens with NAMRS. They also provide the IT support necessary to maintain the system. The Office of Management and Budget approves the use of NAMRS for data collection and was the entity responsible for the most recent renewal of NAMRS, which Carl is going to discuss later today. Next slide, please. There are three components to NAMRS that are used to collect information on APS programs and the clients and victims they serve. All agencies submit the agency component, and most submit either the key indicator component or the case component as well. The agency component, excuse me, provides information and data on their programs, practices, and policies. The key indicators component provides summary data on key statistics related to the number of investigations, clients, victims, and perpetrators. The case component provides detailed, non-identifying data about each investigation and the individual clients, victims, and perpetrators, if applicable, who are involved. Next slide, please. Participation in NAMRS has been high since the beginning. Of the 56 APS programs across the country, including the 50 states, the District of Columbia, and the U.S. territories, only 2 programs did not submit NAMRS data in 2016, and only 1 program did not submit data in 2017. We are very excited about the fact that we have had full participation since 2018, with steady increases in the number of states submitting detailed case component data. States have been working to upgrade their IT systems with recent federal funding, and as a result, there are a few states planning to change the case component for their 2023 data submission, and still more planning to submit case component in 2024. Next slide, please. Personally, it takes me a minute to organize my thoughts when I see this slide, and I recognize that it may be a little hard to digest in the amount of time that we have to share and discuss it. But it is the most accurate depiction of how NAMRS is structured. This is in the downloadable slide deck, so feel free to download it and review it at your leisure. What I want you to take away from this slide is that we collect NAMRS data about clients, perpetrators, and maltreatment within the context of an investigation. The investigation or case must have closed within the reporting year, which is October 1st through September 30th, because NAMRS operates on the federal fiscal year calendar. The data collected about investigations includes information about the types of maltreatment allegations, reporting sources, findings, and dates. Although each investigation is treated as a separate event, there could be multiple clients, multiple allegations, and multiple perpetrators associated to a single investigation. There could also be no perpetrator associated to an investigation. For clients, we capture basic demographic information such as age, race, and gender. The programs also collect detailed client information to assist in addressing the client's service needs as part of the investigation process. So, programs are also able to submit the very specific client information that they collect on issues such as disabilities, behavioral health diagnoses, services or benefits the client may be involved with, educational background, employment status, veteran status, etc., to NAMRS as well. For perpetrators, NAMRS collects the same types of basic demographic information as well as information on disabilities and behavioral health, because again, some individuals named as perpetrators may also be in need of services, and some state programs do provide services to perpetrators. Information is also collected on the perpetrator's relationship to the client, as well as whether the perpetrator resides with the client and how they are associated to the client. Are they a paid caregiver? Are they an unpaid caregiver? Are they a facility staff person? And we also gather information on whether or not the perpetrator has a role as a substitute decision maker for the client, and if so, if any recommendations were made for legal remedies regarding the perpetrator. Now, I've not referenced data on victims, so I just want to point out that the only difference between clients and victims is the finding on the allegations. Clients are the subject of an investigation with no substantiated allegations, and victims are the subject of an investigation with at least one substantiated allegation. So there is no difference in the data we collect for clients and victims. We just focus the analyses that you will see in the adult maltreatment report primarily on data for individuals who had a substantiated allegation of maltreatment or who were found to have, who were identified as having been experiencing self-neglect. That said, we are going to launch another poll. Next slide, please.
All right, our next question is, in which of the following areas do you think NAMRS data is the least complete? And again, this is single choice answer. Is it clients, perpetrators, maltreatment type, or client-perpetrator relationship? For a little bit for you to go ahead and vote. The following areas do you think NAMRS data is the least complete? Clients, perpetrators, maltreatment type, or the client-perpetrator relationship? 4 seconds. Okay, Andy, let's go ahead and close that poll. All right, it looks like we have perpetrators at 47% being the most popular answer. Next, we have the client-perpetrator relationship. Third, maltreatment type, and then lastly, clients. Well, thank you all for taking that poll, and I'm going to hand it back over to our presenters.
Thanks, Jessica. And we're going to keep you in suspense and answer the question a little bit later when Carl is presenting. So let's talk a little bit about what we know about NAMRS. The following set of slides is a combination of data from the Annual Adult Maltreatment Report, the APS evaluation, and technical assistance briefs. It's hardly all the data that we have, but provides a good representation of the types of things we now know about APS programs. Next slide, please. At the beginning of every adult maltreatment report, there is a flowchart outlining the summary data listed on this slide. There is a one-page handout available for download along with the presentation slide deck that provides the actual information from this year's report. No state provides all data elements in NAMRS. Each data graphic in the adult maltreatment report includes a notation on the number of states that submitted that specific data element and the amount of information on that element that is unknown. Next slide, please. So let's look at a few examples of the types of things that we've learned from state APS program data. Each purple line on this graph represents a state APS program. Policy and practice is different across programs for intake, and this particular data set is influenced by the significant variations across states on the population served by APS. For example, some states serve every older adult, while others only serve older adults with a disability. Age criteria differs across states, and the client's living setting may even be a factor in whether or not the person falls within the jurisdiction of APS. As you can see, the range is rather large, with one state accepting fewer than 10% and 3 states accepting 90% or more. And the average falls pretty much in the middle. Next slide, please. We know from agency policies that the length of time for completion of an investigation ranges from 30 days to 90 days across states, and that 74% of investigations are completed within 60 days, as shown in the donut chart on the left. We also see in NAMRS data that for almost 68% of cases, the total case duration, or the length of APS involvement, is also 60 days or less, as seen in the pie chart on the right. That suggests that the majority of cases close during the investigation phase. Next slide, please. That is supported by the actual data we have for case closure reasons, where it shows that the highest percentage of cases for both clients and victims close at the completion of the investigation. When we look at the cases that do remain open post-investigation, it is unsurprising to see a higher percentage of victim cases, or those with a substantiated allegation, than client cases close after the provision of protective services. Next slide, please. In this chart, we see that a third of clients on average have at least one substantiated allegation. And again, the range across states is pretty broad. We have one state that substantiates only 1% of their clients and another that substantiates over 80%. Next slide. One of the most useful ways we can use the data is to look at what is occurring with the different types of maltreatment through the lens of client characteristics or other program data that we have. I'm going to use self-neglect as an example for the next couple of slides that I discuss. The number of individuals who experience self-neglect is higher than the number of victims for all other maltreatment types combined. This has been consistent across the years of collecting NAMRS data, making it the most prevalent form of adult maltreatment. We also know that most APS programs investigate reports of self-neglect, while some of the other maltreatment types that have very low numbers of victims are not investigated by as many programs. Next slide, please. Here's another way of looking at the prevalence of self-neglect. We saw earlier that 33% of all individuals involved in an APS investigation are found to be victims. And of those individuals, more than 71% have an allegation of self-neglect. Even among the 67% of individuals who do not have a substantiated allegation, more than half have an allegation of self-neglect. So not only is self-neglect investigated by almost every APS program, it is also the most frequently reported allegation. Next slide, please. The data can also be broken down and looked at by state. Here we see the distribution of individuals with an allegation of self-neglect who were found to be experiencing self-neglect across states, with a range of 12% in the lightest blue state and 96% in the darkest blue state. Next slide, please. This slide is an example of information that can be particularly important for programs focused on developing and planning services for individuals in their communities who are experiencing self-neglect. Clearly, providing for their own care and managing independent living activities are the primary difficulties. And services would also need to consider meeting the needs of individuals with mobility and cognitive functioning issues, as those are also fairly high. Issues with vision and hearing are not as prevalent, and the need for services that also address those issues would be much lower. Next slide, please. This I just included because I thought it was interesting. What we see here is that over half of the individuals experiencing self-neglect have more than one disability identified. And when compared to other maltreatment types, individuals experiencing self-neglect have a slightly higher average number of disabilities than individuals experiencing other forms of maltreatment. Okay, I'm going to stop talking about numbers and turn this over to Carl. Please put any questions you have in the questions box, and we will try to get to them at the end of the presentation. Thank you. Next slide, please.
I believe our speaker, Carl Urban, may be on mute. Carl?
Yes, I was on mute. Hi, I'm Carl Urban. I am a senior research manager here at WRMA. I told myself I wasn't going to do that. I have been the lead for NAMRS for the last several years. And I'm going to talk a little bit about things that we're doing and going to be doing to try to improve NAMRS. You know, we have worked very carefully for the last couple of years with the APS programs to improve their data submissions, particularly the completeness of the data. And all of this is an impetus to try to improve data quality and its use for management. And so what I'm going to talk about is our ongoing efforts, data renewal and data completeness efforts particularly, to improve NAMRS. Next slide, please. So let me first talk about data renewal. And when I say data renewal, what I'm talking about is the process that ACL has to go through every 3 years to get the data collection reauthorized through the Office of Management and Budget. Y'all recall that slide earlier where we talked about the different responsibilities of the different organizations. Part of our technical assistance support for ACL is to kind of prepare all the documents and do all the work for them through this whole process. And so NAMRS was reauthorized in March of last year for another 3 years. And the process that we used with ACL was very stakeholder input heavy. We collected lots of information on both the data elements themselves as well as how the overall system was working. And so when we got through with that process, we had data changes in NAMRS really kind of for the first time. And we shared a lot of information with ACL about how the system itself could be improved. So next slide, please. Just to give you some sense of what we did during this process, here is a list of the questions that we asked from the various stakeholder meetings. We asked about changes in the field. We ask what's not being captured that we think is important to understand APS. We ask, are you making changes in your data collection systems that would influence what data we're collecting and the way NAMRS works? And then we just ask a basic question about changes in law or policy that we should be collecting information on as it relates to NAMRS. Next slide, please. We held listening sessions with all of the groups that you see listed here. We thought it important to get input from a wide variety of stakeholders. We held multiple sessions with the APS programs. And so next slide, the result of all that was actual changes to the NAMRS data elements. When we went through this process 3 years ago, we didn't make any changes to NAMRS. This time we made the changes that you see listed here. Maybe the biggest change was in the agency component. We added a bunch of policy questions. We had been working on the APS evaluation kind of concurrent to this, and in that we had delineated a bunch of policy variables. And while the agency component was already collecting some information on policy, we thought from what we had learned through the evaluation process, there were things that we just wanted to ask about on a recurring annual basis and basically get to a place where we can establish a policy database for APS. So we added a bunch of questions related to policy, and you can see the topics that are listed there. For the key indicator elements, we added a new data element to collect data on the number of perpetrators. It was kind of a quirk in the data where we actually weren't asking just straight up the number of perpetrators. We could kind of back into it, but now we're collecting it straight up. And then for case component, we added one new data element related to communication assistance, was all. However, for both key indicator and case component, for the existing data elements, we did add a bunch of new code values to collect data on new areas of interest. So for example, one of the things that we heard back in the listening sessions is we need to know more about whether a client is an HCBS client, are they in an HCBS group home? And so where we had questions where that could be part of the response, we slotted in HCBS services. We also made some changes to conform with new standards as it relates to demographic information for SOGI, SOGI standing for sexual orientation and gender identity. And this just is a couple of examples of the types of changes to the data elements we made. We worked very closely with ACL staff on this. We sat down and we processed every comment from all of those listening sessions, synthesized them and discussed them with ACL staff, and ACL staff worked with us to make decisions about the changes that we wanted to make to the NAMRS data elements. So next slide. So what about changes to the system itself? Basically, NAMRS has not changed much in the way it works since it was developed and implemented. We've made just a couple of little tweaky things. We fixed some bugs and defects along the way, but there's really not been any significant changes to it. We have a running list of potential changes in terms of a requirements register that we submit to ACL every quarter. We solicit every year from our users potential changes to the system, and ACL has that list of potential changes. And there were kind of some more macro sorts of changes that we collected through the listening session that we also provided to ACL. This will be the year that changes are made in the data system, both to reflect the data renewal changes as well as some of these other changes that are high priority for improving the system functioning. So next slide. So for all of you out there that are system users, and we have tried to communicate this through our liaison process this year, stay tuned for information and training on the data and the system changes that are coming later this year. We will be putting that together for you later in the spring and in the early summer. So next slide. One of the things that also changed as part of this data renewal process was a description of how we were going to use the data. Up to now, we have not been, without getting explicit permission, sharing state-specific data about NAMRS. There's a number of different reasons for that. In part just because it's, you need a data system to kind of grow and mature over time, and we want to become more confident in the data. We want states to be more confident in the data, and to get it to a place where we were felt comfortable with the quality and understanding what the strengths and weaknesses of it were before we started sharing state-specific data. With this data renewal, we explicitly stated that we were going to start sharing state-specific data. And we have had conversations with all of the states as we've gone through our liaison process, and to make sure that they are aware of that. And so that is one big change that we are going to make going forward. Another change that we have made, not well publicized, but it's available, is we have stood up a process for requesting data, both the public data and requesting individual specific data from the system for researchers or for states or anybody that may want to have access to the data. So if you go to the APS TARC NAMRS website, you can find that process and those wonderful forms that you have to fill out to be able to request the data. We think all of this is really important in terms of the evolution of NAMRS, because it's getting us to a place where the data is available to state programs and for others to do things like benchmarking and any sorts of related efforts at program improvement. This is a nice concurrence with the publication of our evaluation report, which also has a lot of interesting state comparison-like data. And so when you put the combination of the evaluation data together with the NAMRS data, we have a pretty robust picture and understanding of how the APS system operates. And that's information that's now available for programs to use for program improvement. We've got a very explicit process this year where we are working with individual states to take a look at the data and have conversations about how do I compare it to the system as a whole, where are the places maybe I should think about making changes. And if you're interested in kind of having that sort of conversation with us, please talk, if you're an APS program, to your APS liaison. Next slide, please. So let me shift from talking about data renewal and the ways that we are using the data to talking about some of the strengths and weaknesses of the data. Back in the year 2020, looking at 2019 data, we did a very thorough data completeness analysis for the Administration for Community Living to try to identify where there were gaps and variation in the completeness of the NAMRS data. And so we were trying to look at which data elements were actually provided, and then if a data element was provided, how much of it was unknown, and I'll talk about that a little bit more in just a second. And so as Leslie already pointed out, and it's worth re-emphasizing, when you look at that NAMRS data, you should always be paying close attention to the footnotes in terms of how many states are presenting particular pieces of information. When we prepare that adult maltreatment report, you will notice there's a lot of data elements that are not in there, and that's because we don't have a high level of confidence in the data completeness of the data, or there's a lot of unknown data, so we don't typically provide that data. So next slide. So when we're talking about data completeness, what do we mean? Typically, we have kind of two constructs that we think of this in terms of. We think about, okay, how many states are providing a particular data element, and then for that particular data element, there's going to be data in particular case records in which it just was not collected, or for whatever reason it was unknown. So you have both missing and unknown data, and so we asked, was the data element collected? And if it was, how much of it was unknown? Next slide, please. So with that kind of framework in mind, we did this data completeness assessment for ACL to try to identify the weaknesses in the NAMRS data, with the ultimate goal of trying to come up with some strategies for improving data quality. This was important to do for several reasons. We wanted to understand how the data can and can't be used, what is its strengths and weaknesses. We wanted to target what are the potential realistic areas for improvement. And then this helped inform our process as we went through the data renewal efforts that I described earlier. So next slide, please. So what did we find? So as you saw on one of the early slides that Leslie did, both the number of states providing case component data and the number of data elements that they provide has increased. And I'll show you how that's increased since 2020 as well here in just a second. But the amount of unknown data has basically was not improving at that particular time. We found out that victim data and perpetrator relationship data, we found out that victim data is the best and the perpetrator relationship data is the worst. There was a lot of variation across the states in terms of data completeness. And so one trend that we saw in the data was that the states that provided the most number of data elements also had the highest amount of unknown data. And that actually kind of makes sense when you think about it, because they're collecting data elements. Maybe if you think of it in the inverse, it kind of makes more sense. If you're collecting fewer data elements, then you're more likely to be collecting more of that particular data. Another thing was that basically the demographic data was the most complete data of all of those data types that you saw that we talked about earlier. So what do we do with that? We want to reduce the gaps and increase the completeness. And so we had to talk to the states about that. And so we, as part of our liaison process with the states, developed very detailed charts of them for them with this data, show them the data, and had discussions with them. Why are you not reporting this particular data element? Why for this particular data element is there so much unknown data? And so we started doing analysis to better understand what was going on at the individual state level, so we could think about it at the system level in terms of understanding why there is incomplete data where there is. So next slide, please. So, as Leslie said a second ago, there is still significant variation across the states and across the individual data elements. And so as a result of those conversations, this is kind of what we found out from talking with the states and looking at the data. Few states provide most of the data elements. And as I said, those that do tend to have gaps in their data. Only the demographic data has very complete data. Client and victim data has fewer gaps than perpetrator data and perpetrator relationship data. In terms of the consistency and accuracy of the data, NAMRS has built into it a number of validation rules and edit checks. So if data is outside of a particular range for a particular data element, states are going to have to provide an explanation of why that data is that way. Those quality assurance processes built into the system help to ensure consistency across the data elements, but they are not, they're necessary, but they're not all that's really needed to ensure perfect accuracy of the data. One of the things that we wanted to particularly look at was the unique identifiers that are in the data. States are supposed to use the same client ID across years. They're supposed to use the same perpetrator ID across years, so we can track things like occurrence. We found that for the most part that is being done. One of the specific things that we found out was that other was sometimes being used inappropriately, and we have had, since we discovered this, some very explicit conversations about the use of other with the states in terms of understanding what data categories are using and trying to improve the different variables and different code values that they're using for different data elements. And so, next slide. You guys were terrible in that poll that we did earlier. You had it basically exactly backwards. The data on clients and victims is the most complete data. The perpetrator relationship data is the least complete data. So think about that from an APS caseworker's perspective. You're collecting information on the client during the intake to collect the basic demographic information, and then you're trying to document the needs of the client as you go through the process, and so that is the data that tends to be collected the most. Perpetrator information we find is much harder to collect. The caseworker may never come into contact with the perpetrator. The collaterals that are interviewed may not know much information about the perpetrator, so we're much less likely to collect information on perpetrators. And then the relationship data between the client and perpetrators even harder to collect. Next slide, please. So we did that analysis back in 2020 for ACL that I've been talking about. Last year, looking at 2022 data, we said, okay, how are we doing? Are we getting better? And so what you see here in this chart is two ways of looking at that, kind of based on those two ways we defined data completeness earlier. That first column, total number of data elements across all states, basically takes the number of data elements that are being provided across all of the states. So if you've got 32 states providing 22 data elements, on average, you can get to the total number of data elements. So you can see over time, it has gotten a lot better. We've gone from 611 to 1,152. Slowly and surely, states are adding an increased number of data elements that they are being able to report, that they're able to map, and that they are able to report. So, given that a higher number of data elements tends to result in more unknown data, at least at the individual level. When we were looking at that back in 2020, what's happened to the amount of known data? And that has actually gotten a little bit better over time. States have gotten better at working with their staff to get data filled in as they have progressed and as they have gotten more used to the actual data elements that are in their systems for NAMRS. So next slide. So when we talk to the states, we basically ask them a few questions. Why are you not reporting case component data? Why are you not mapping to certain types of data elements if you are reporting case component data? What's the overall data completeness pattern in your individual state? And as we look at this pattern, can it help us determine why you may have incomplete data? And then just, okay, you're missing information on perpetrators. Why do you think you're missing information on perpetrators? Why is there missing data? Why are you not able to collect certain types of data? So we had those conversations with the states. And next slide, please. And so we came up with some common reasons that cut across all of the states. Reason data is not mapped. It may just simply be the case that state policy is not consistent with the way that NAMRS collects the data. And so they're not collecting data in that particular way. It may be that the way that the state has historically defined what they collect in terms of the code values, they don't align with NAMRS and they can't make the crosswalk work. A real good example of this would be particularly in the area of services data for clients. We find a lot of states are not able to provide services data because there's kind of a mismatch in some cases between what code values, how they classify the services they provide and the way NAMRS collects the data. We find that some states that have particularly shared IT systems, whether that's with the aging network or whether that is with CPS program, often have a misalignment in terms of the way they're collecting the data and the way that NAMRS is collecting the data, and so it's hard to map the data. There is the problem of, yeah, we collect that type of information. They're going to note in the case documentation what's the nature of the relationship of the client, the perpetrator. However, it's in the notes. We don't have a field for that, and therefore we're not able to generate something that we can actually map, count, and include in NAMRS. And then the point in time documentation is a problem for some data elements. So that's reasons the data is not mapped. Why is there missing or unknown data? And there are lots of different potential reasons that we were told for individual data elements that data could be missing. And some things are just difficult to collect for whatever reason. It's often the case that what we think is important in NAMRS, the state may actually have within their data system, but it's not a required data element. States in their case management systems have a lot of information that they try to collect, but not all of it was required, and you need to have those required data elements because some things are more important. And so if something is not a required data element, we will find that it is often not collected or has missing data. You know, the thing that goes along with that is, you know, caseworkers intuitively know that some things are more important than other things in terms of the metrics that the program looks at, in terms of what helps them get their job done. And so just some things are more important than other things when it comes to a caseworker thinking about it. And then some things are just not comfortable to ask about. Some of the demographic information is not comfortable to ask about. And so it's sometimes difficult to ask information about the perpetrator. And there's just, you know, you can go through case example after case example of how that can be a problem, and workers are just not sometimes comfortable trying to collect sensitive information. We actually did a webinar on this at one point, trying to provide some tools and tips to help workers with that, and that webinar is still available on our YouTube channel. And then sometimes it's just difficult to enter or input the data into the system. We think there's processes and protocols you can use to get there, but the reality is that sometimes, particularly some of the outdated case management systems out there, it's just not real easy to get the information into the system. So next slide. So what? Here's some of our key takeaways from all of this. Improving data completeness is going to continue to be a goal for the APS TARC and for the administration for community living. Better data will result in better program improvements. And so we're going to continue to make it a goal as we go forward and in terms of our ongoing discussions with the state APS programs. As we move to using state-specific data, we are hopeful that programs will see the value of the data in terms of processes like benchmarking and any other number of ways that they can use the data for program improvement. We're hoping that that knowledge, that recognition will incentivize ongoing improvements in providing better data for us as we go forward. The state-specific data is also going to have the benefit of allowing us to explore some topics that we've not been able to explore before. So we can look at issues like equity across states, where you have to look at the demographic information from one state to another state, from one county to another county, to be able to do some comparisons to help you draw some conclusions about certain types of topics that we just couldn't look at until you drill down into the data and look at it on a state-specific basis. And then hopefully, as we look at data on a state-specific basis, that will give us information that we can continue to use to highlight where we can improve data completeness and accuracy issues, help us to determine those areas that we think are most important and that we should work with states to prioritize collection of data on. So going forward, a couple of keys to success. Carol Dayton, who is the chair of the NAPSA Research to Practice Committee, often, and she said this often as part of the administrative data initiative process, said, you know, we've got, as we use APS data, we've got to make why it is important to collect that information clear to caseworkers and to APS program management. They've got to see clear best use, best practice use of that data. And if they see how that data will help them to improve the program, then they're going to have greater incentive to do a better job of collecting the information. And hopefully we can address some of the missing information that way. I would point out that there is this APS Administrative Data Initiative that the NAPSA Research to Practice Committee is doing. If you're not familiar with that, send me an email and I can get you plugged in to that initiative. That's an initiative to help us focus on better ways to use APS data. And then the last thing is something that's actually occurring is programs have to make it easier to collect data through improved case management systems. So that case note that I was talking about earlier that has information on the client-perpetrator relationship can be turned into some sort of data element that we can continue to collect, and maybe someday as that data completeness gets better, we can do better research and have a better understanding on the nature of client-perpetrator relationships. The good news here is that a number of states are upgrading their case management systems, particularly with the recent federal funding. Our discussions about data completeness means that states are saying, hey, this data is really important for understanding what we are doing, and so we're adding these few data elements this year. We're conducting training this year on trying to collect this type of information better. And so as we see the case management systems and the training on those systems improve, we are very hopeful that we will continue to see better data from APS programs as we are going forward. And with that, I think we've got about 10 minutes for questions.
So much, Carl and Leslie. Lots of good information and lots of questions here. So I'm going to start with, but is there any information on states that takes the least amount and the most amount of cases? I know there was a lot of numbers. So do we have any information on that?
Say that again, please.
Yeah.
States take the least and or most amount of cases.
So there's different ways to interpret what that means. The short answer to that question is yes. I guess what I would want to know is, at least in most amount of cases, relative to what? Relative to the number of reports that they're getting? Then the answer to that is yes, and you actually saw that chart that was earlier relative to their population. The answer to that is also yes. If you'll look at the evaluation report, you will see, and we didn't include it in here, but you'll see a very similar chart to that reports accepted chart in terms of the number of investigations per the population in the state.
Thank you so much for that. We have another question here, Leslie. I believe this one's going to you. We're reflecting back on one of your slides. So on the slide entitled "Percent of Persons Experiencing Self-Neglect by the State," can you please explain what that slide means for the state in gray?
I'm sorry, I did mean to say that we did not have the numbers for those that were not colored in blue.
So many of those would be non-case component reporting states, so we don't have the client-specific information by maltreatment type.
Exactly. I also want to make one clarifying comment, because I showed that one slide with the NAMRS structure, and I needed to state, and did not do so, that that's the structure for the case component, because the key indicators data is much simpler. It's high-level summary data that we're literally just pulling the numbers for. So that more complex structure that I showed on the slide was relative to case component. I just wanted to point that out. Sorry.
Verification. Next, we have a statement followed with a question. In some states, APS does not investigate allegations in long-term care settings. Instead, those incidents are sent to the long-term care ombudsman to investigate. Does your data combine APS and LTC ombudsman data?
So I don't mean to be argumentative with the statement, but my understanding is that long-term care ombudsman programs, by rule, do not investigate abuse, neglect, and exploitation. The healthcare licensing agency for long-term care facilities would do those investigations. And so to the question of whether APS investigates or not, I'm afraid the answer is it depends. It depends on the state. You know, there's 51 states in DC, and there's 51 different ways determining jurisdiction for various types of incidents in long-term care facilities. Roughly, and again, there's data on this in the evaluation, roughly half of the APS programs are going to conduct some type of investigation in long-term care facilities, and we will have some of that data. But generally, NAMRS is not collecting the information that the licensing agency is doing an investigation of. There's one or two states that are actually providing that information to us, but most states do not.
Thank you, Carl. Next, another question regarding data sharing. Could a university in my state request APS data through the ACL website?
Absolutely.
No. Another question here. What was the most prevalent services for self-neglecting victims regarding differences in Medicaid versus private pay self-insured victims? So was there any correlation for self-neglect in regards to healthcare? So Medicaid versus private pay?
Leslie, I don't think we know that.
I think you are right. I think that the, well, first of all, we definitely haven't done any analysis on it where we've pulled that.
That part is definitely.
Because I've never seen that data pulled. But the other thing is that is one of those elements that would be highly contingent on the state providing that information on benefits. And so it would have to be something that was a high
So
submission.
we do collect information on benefits
Mm-hmm.
and services, and we could do, I'm about to contradict myself, I think. And we could do an analysis comparing benefits and services for only self-neglect clients. That is something that we have never done. And the benefit, and so in terms of the data completeness, the benefits information is one of the weaker data elements. So we've really never done much analysis with that. But yeah, I think if I understand the question, I do think we could somewhat get at it. That's an interesting question.
True.
Leslie, I'm thinking about that right? We collect the benefits information.
Yes, that's you said exactly what I was trying.
Just self-neglect clients.
Yes.
I had to think about it.
All right, another question. We have time for a few more. So there's a question where we can find the data dictionary for NAMRS.
Yeah, you can just go to the NAMRS website on the APS TARC website, and there are links to the data dictionaries for agency key indicators and component.
And this is Andy Capor.
That's still there, right?
Just put the website in the chat for everybody. So if you're interested in reading more about that, you can go to the website that we just entered in chat.
All that. Another question, is there a way to track how many clients refuse services in fear of losing their home to the state? Example, Medicaid repayment.
Okay, I'm gonna think for a second before I answer this time.
I don't know that NAMRS collects information on why clients are refusing services.
Yes, I think that's correct. One of the case closure reasons has to do with
client refusal. Yes.
Client refusal, but we're not going to get to the second part of the question.
Correct.
Another question here, for the 36 of the states that provide CC data, how many of them also routinely identify the county within their state in which the investigation occurred?
Oh, if you gave me 5 minutes, I could answer that question, but I can't do it off the top of my head definitively. I would say, as a generalization, most. Andy, Leslie?
I would have said the same thing. Yeah, but we'd have to actually look at the data.
It is definitely not universal, though. PIPS codes are still problematic for some states.
And without going down the rabbit hole of how that's collected, there are codes for each county, each location in the U.S., even overseas codes. And most states are pretty good about providing that, I think.
Mm-hmm. If they're doing case component, yeah, they are.
If they're doing case component, yeah, that was a good predicate of the question.
Yep.
All right, well, great information, and I just want to thank the audience, some great questions. Can we go ahead and go on to our next slide? We are just about at time. So here is our social media contact information. Please follow us. And just a friendly reminder to complete that eval, that brief survey that you will receive. And we would like to thank our speakers, both Carl and Leslie today. Lots of great information. I myself learned a lot as well. And I hope that each and every one of you on here today enjoy the rest of your day. All right, stay safe and healthy. Take care.
Thanks, everyone.